Hello and welcome back to our Growing Together Parent video series. This month I am joined with Amanda, a labor and delivery nurse, as well as a Board Certified Lactation Consultant here at Woodstock General Hospital. We are actually currently sitting in one of the delivery rooms right now, which is awesome for you guys to have a little sneak peek. I want to thank everyone for sending in their questions. We'll hopefully go over all of them. Amanda will be sharing with us what works best at the Woodstock Hospital. All hospitals may do things slightly different, as well as every delivery doesn't go as planned. So just keep that in the back of your mind. All right, so the first question that came in was, what supplies are provided for after birth care for mom, and what do I need to pack for myself?
Okay, so a very common question we get. So the hospital provides 3 meals a day for the birthing parent. So we do encourage you to bring snacks for yourself if you have a late night delivery or an early morning delivery for yourself as well as your support person. We do provide some immediate menstrual products, peri-pad and mesh underwear for the immediate postpartum period, but we do recommend that you bring your own pads and underwear, nice stretchy comfortable underwear that you can wear afterwards just to your liking. A lot of people I'm finding now are bringing in adult briefs to wear, which I think is actually brilliant.
Absolutely.
Because then you can slide one of our ice pads in for your sore perineum. So that is something else we provide, our ice pads for our families to use, which partners can get them, support people can get them, we can provide them for you, but they are available as they need them.
Okay.
So I do find that those briefs are a nice addition for that reason. We provide medications for women or birthing people who require medications after delivery.
And that would be like your pain relief?
Yeah, so ibuprofen, Tylenol.
Okay.
If you've had a C-section, we do offer obviously some stronger medications because abdominal surgery is no joke and you need very strong, sometimes pain medication for that.
Absolutely.
Definitely, I think sometimes we pack a little more than we need. So I would recommend a comfy pair of pajamas, again, that nice stretchy underwear. Snacks, I can't stress the snacks enough. We do provide a peri bottle, but lots of women are finding that they'll purchase their own peri bottle and want to bring that in, which is totally fine.
Okay.
If you have it, a breastfeeding pillow is always recommended. We do have one for people to use, but if you have your own, we encourage you to bring that. Toiletries, a long phone charger. Our outlets are pretty far from the bed, so long chargers are always helpful. And I do find some people will bring in a fan for labor. Which is actually quite helpful in the early postpartum period if you are a hot sleeper or if you just like that little bit of white noise. I do find a lot of people are bringing that in.
And can they use that fan during delivery?
They can.
Awesome.
Yeah.
Awesome.
It's easier than us fanning them. So
it's
great if they bring their own. And you can buy them. They're pretty cheap now, and people get them for their stroller, so then you can use that afterwards in your stroller on hot days.
And it'll actually probably attach to the bed.
Yeah, I think a lot of the ones that people are buying are actually meant for strollers, but then they have these really nice adjustable arms, and so they can be placed anywhere. So I do find those are quite helpful.
Yeah.
And then we do have a patient pantry available down the hallway for, there's some beverages in there for the laboring person. There's also a hot tea water machine, a microwave, and an ice machine. So we do encourage you to bring your own water bottle if you want. I've been told we have excellent ice.
Yes.
So you're welcome to do that. We just ask that you don't leave home food items in the fridge for infection control reasons.
Okay.
Yeah. So otherwise, we do provide fair bit, but we do encourage you to bring your own comfortable, homey.
Yes. And I think a big one that we often hear in the prenatal classes is pillows. Are they allowed to bring their own pillow in or a blanket or something comfortable?
Absolutely. They're welcome to do that, and just remember to bring them home because it's unfortunate when they get left behind. But yeah, you're welcome. Breastfeeding pillows from home, a blanket. If you have a comfy blanket, you want anything to help you become more comfortable.
Yeah. And I think too, if you are planning on breastfeeding, that bringing that pillow in so that lactation consultants like Amanda can help you position that and get that comfortable because yours may not be the same as the one that the hospital has in your stay. Awesome. Okay. Our next question is, what is provided for baby, or what do I need to pack?
Okay. So for baby, we're more so asking you to bring things like diapers, wipes, a couple of weather appropriate clothing items or outfits. We do encourage lots of skin to skin after. So we tend to want the baby skin to skin and not in outfits, but certainly a few weather appropriate outfits are appropriate. We also ask that you bring a blanket or something to put over the baby car seat for discharge if it is a cooler day. They are able to wear thin layers under the car seat, just nothing too fluffy and poofy. So bring a car seat, I guess, would be the other thing. So,
that's a huge thing, actually.
Yes.
Absolutely. And with the car seat too, can you kind of talk about what that would look like when they bring the car seat in?
Yeah, so you can bring in your car seat at any point. We are educated on how to position the car seat straps and know if it's too tight or too loose. You'd have to go to a car seat clinic if you want the base inspected. So we will check and make sure that the positioning and the tightness of those straps are appropriate for you to go home safely with your baby. But we do ask any further inspection happens with a more formal inspection agency.
Which, if you are looking for that service, we do run those car seat clinics twice a year. So if baby is due within the next few months, you can give me an email. My email will be in the link below, and we can get you hooked up. Okay, so back to that. So what else is provided for baby, or what should they bring?
I think the other thing that people are bringing in that I do find is helpful is a little nightlight sometimes, or sometimes you can get a nightlight white noise machine in one. So I do find just these lights are quite bright, and it's almost an all or nothing experience with the lights. So sometimes having a smaller light is nice. And otherwise, just we like to not forget about the support people. So we need to bring clothes for baby, but don't forget some maybe pajamas for your support person so they're not walking around in inappropriate clothing. Just some pajamas and some snacks and comfy stuff for the support person too is also something to consider.
And I guess with that too, will they be provided a blanket and a blanket and a pillow?
We do have pillows and blankets for our support people. We have blankets for the babies. We do have the bassinets that the kids will sleep in while they're here. We ask that all the babies are on their backs to sleep for safe sleep. So aside from that, or a safe sleeper, swaddler if you have for bedtime. Otherwise, again, we really stress that skin to skin. So
of course,
as much of that as possible is what we recommend. So otherwise, they need very little. They need
just
food.
The basics.
They need food and warmth and skin and
diapers and wipes.
Diapers and wipes.
Awesome.
We do have infant formula, like a ready to feed infant formula for those babies that require it. So if there is a formula brand that the family is interested in working with, because that is their plan, they're welcome to bring that in and we can talk about preparation and what that looks like. But generally speaking, diapers, wipes.
Awesome. So you don't need the whole 9 yards of packing everything for your baby.
No, we often pack way more than we need.
The basics, and baby needs you. Awesome. Okay. Moving on to the next question. What pain medication is available if I feel like I need it?
Sure. So most commonly, we will offer a subcutaneous injection of morphine. I find that's most effective in the early part of labor, so that might be something that people are offered maybe in triage or in the early phase of their labor. So morphine by subcutaneous injection would be one. We also offer the nitrous oxide gas that they would inhale by face mask. And then everyone's leading favorite is, of course, the epidural. So we do offer epidurals day and night.
That's good to know too. Day and night.
Day and night.
Right.
Depending on the patient's history or their personal preference, they might request something else, and so that's just a conversation that can be had between the doctor or the anesthesiologist. If what we have to offer isn't appropriate for the patient, that's something that we can also discuss.